Coming up today, shot 3 times at point-blank range. Her face shattered, her spine fractured. Doctors weren't sure she would survive the night, but she did. Today, this young woman and mother and doctors share how she rebuilt her life. Good morning, I'm Jessica Lovell, and welcome to the Morning Medical Update. A child exchange turned into a violent encounter when 21-year-old Abbi Winters was shot while sitting inside her car. She was rushed to the hospital with life-threatening injuries. It took a coordinated team of trauma surgeons, specialists, and critical care staff to save her life and help rebuild her future. Now, we do want to warn you, this story does contain some graphic content.
You reached Wyandotte County 911. Do you need police, fire, or medical?
I heard something loud. I didn't know it yet, but I had already been shot twice.
We shot her in the face. Close range, twice, with some kind of rifle.
I went to cover my face and apply pressure, and there was like nothing there. I reached into my mouth. Like I reached straight up, and there was no cheek right here.
Abbi Winters was just 21 years old when she went to pick up her son Styles at his dad's house. That's when her ex emerged from his home, pointing a shotgun at the car she was sitting in. He pulled the trigger 3 times.
So it hit the window because the window was up, and it was a pretty good window, like a strong window, I guess, on a Cadillac. The bullets blew up. So a bunch of metal shards hit me everywhere. So it was not like I got shot in one place. I got shot in like 100 places.
Is your daughter awake? I can't tell. Yes, but she's breathing.
Despite her massive injuries, Abbi remained conscious through it all.
I was thinking about my mom and my son because I didn't know if my son was alive in that house. So I was just looking and looking and looking for my son. Any sign of him to come out of the house, yes. And then my mom strapped him in the car, and I listened to him cry. And every time he would cry, I would take the deepest breath I could. And I think that's what made me survive, honestly, because every time he would cry, I just took the deepest breath.
Abbi was rushed to the University of Kansas Health System.
It fractured my spine. It took a piece of my tongue. It took my cheek. The top of my mouth is completely reconstructed from my wrist. It was just gone. I could stick my tongue into my sinus. It was just very extensive. I had to learn how to walk and talk again.
It took a team of surgeons and specialists to keep Abbi alive.
My face was gone. I mean, it was gone. I had the best surgeons, waiting, and just team in general. They're the reason that I'm alive, for sure. I remember that I woke up here first, and I forget what they call it, but they had to restrain me to the bed because I had a trach. So I didn't pull my tubes out in my sleep or something.
Once a vibrant young girl, a competitive swimmer even, in good shape, Abbi was now facing a whole new reality.
Still trying, it's a process. It's not like you wake up one day and you feel better, because I don't think that my body will ever feel as great as it did.
The miraculous part, she survived. But the worst part?
I really feel like my whole motherhood was stripped from me. I couldn't pick him up. He couldn't be on top of me. I couldn't lift more than like 5 pounds.
The physical pain is real and still there every day. But the scars show a different pain.
My appearance affects me the most. Like at first, it broke my heart. I would dream about my other face and wake up to this, and it was exhausting.
Are you coming?
Good job!
But she's living each day for her son and finding purpose through tragedy.
But I'm finally adjusting, and I think that this is what I'm supposed to look like, and this is what, God had intended for me.
Good morning, guys. It's me, Abbi again.
Happy Domestic Violence Awareness Month.
You can always pick yourself up.
You deserve to be on the other side of healing.
And I think that is this is the path that I'm supposed to be on. In order to shake people into reality, I feel like it had to be this extreme.
Well, we are beyond grateful to have Abbi Winters here in our studio this morning, and we are also joined by two members of her incredible care team, Dr. Hannah Maxfield, who is Abby's general doctor, Dr. Eric Wessel, Abby's trauma surgeon at the time, and we're also joined by plastic surgeon Dr. Michael Lipka. He's part of the trauma team here at the health system. He did not directly treat Abby, but he treats facial injuries and can offer some perspective on these kinds of trauma cases. So we just want to thank everyone for being here to join this discussion. Abby, how are you doing today?
I'm doing wonderful today. I'm feeling pretty good this morning.
Well, we're just so glad to see you here doing well with us. I wanted to start with you. What's been the biggest injury to overcome?
Is when they broke when they repaired my heart, they had to break it twice. Like they had to open it once and then open it again for some reason. I never figure out why, but it led to like long-term chest pain and deep scarring.
You take a lot of pain medication, correct?
Yes, that's for sure. I have chronic pain, gastroparesis, just things like that have come from the trauma because I was perfectly fine before.
Dr. Maxfield, you continue to care for Abby today. What are the biggest long-term health concerns after a trauma like this?
Well, certainly, as Abby mentioned, the chronic pain, it never goes away completely. And I think there's so much, drama about narcotics and pain medications, but Abby really uses them to function better, as opposed to letting them be a barrier to living her life.
What's it like when you see Abby today, when you see her month to month, and what's it like to see her?
Just that she's living her life the way she wants to.
When you see her playing with her son,
yeah,
I bet
she's
that's a
not
joy.
letting it hold her back at all.
Thank you.
Mm-hmm.
Dr. Wessel, going back to that horrific day, how does shrapnel, gunshot injuries like Abby sustained near the chest affect the lungs and the heart?
Yeah. The biggest concern that we have up front is really just injuring the vital organs like the lungs and the heart, and that they can bleed and bleed a lot because all of the blood for the entire body is going through that area every single second. So in her case, she had a hole in her heart which needed repaired. She had a hole in her lung which needed repaired. There was injury to her chest which needed repaired. So it unfortunately took a lot of surgical trauma, which is leading to the pain that you have now, in order to stabilize things.
So much going on in one moment. How do you know? Are you operating? Are you stabilizing? How are you making those decisions in those critical moments?
Yeah. It really comes down to how the patient is doing and whether they are stable or not. And in her case, she was not stable. These were life-threatening injuries, and we had to operate immediately for her.
So who takes the lead in a case like this where there's so many specialists involved?
It really depends on the timeline of it. Up front, the trauma surgery team, people such as myself, kind of take the lead on everything. But after the initial stabilization, when we're done treating the life-threatening injuries, we coordinate care with everybody, with the plastic surgeons and any other specialists that are needed.
Dr. Lipka, we're a level 1 trauma center here at the health system. We unfortunately see our fair share of gunshot injuries and catastrophic injuries like Abby had. How do we know what to prioritize when patients like this arrive here at our hospital?
So obviously it's the life of the patient, most importantly. The facial injuries take a back seat actually, but if there's any bleeding, that needs to be taken care of. Initial stabilization of the bone, and then the secondary reconstruction, which is done later.
We mentioned you did not treat Abby, but talk us through some of the facial surgeries that Abby needed at the time.
So she had initially some debridement of some of the devitalized bone and structures, and she was missing some soft tissue of the palate. She talked about how she could bring her tongue into the roof of her mouth. So she actually had tissue taken from her forearm and then attached to vessels in her neck to reconstruct that soft tissue in the palate. Then and she had soft tissues moved over from the side of her face to reconstruct the skin, and then had a later reconstruction of the lip, lower lip to upper lip, so some interesting plastic surgical procedures to get her back into a reasonable position.
Was rough. The one where we connected my lips and I only had like this much to speak out of.
Yeah.
I got sick during that, and I could only throw up through like the switch of my mouth.
Yeah, that's a really tough one for patients to go through when their lips are sutured together. It's really an old, really plastic surgery technique to get tissue from one place to another.
But it gave me a lip.
It gave you your lip back.
Yeah.
And you said about how many surgeries did you have to go through that you remember?
I have no idea. There were so many by the time I even woke up. When I woke up, I still had a tissue in my gunshot wound. So like we had so many surgeries, I don't remember.
And that's pretty typical, Dr. Lipka, where you just don't know how many it's going to take until you start healing and seeing how the process goes.
That's right. The goal of gunshot wounds, really, we try and do as much as we can at the first setting and get the bones in the correct position, and that's really helpful. Traditionally, things were done secondarily, and we try and do as much as we can up front.
Abbi, can you explain the surgery for your eye? You're pretty good at kind of explaining what had to go on there.
Yeah, we took a skin graft. My most recent one, we took a skin graft from right here, and then I had placed it in the top of my eyelid, because I guess that skin would have been more like an eyelid than before, because my eyes were stuck open, like completely open. Like it was just, I couldn't blink, I couldn't do anything. So we have one on the bottom from a previous surgery, and then my new one on the top.
We're going to talk more about your prosthetic eye here in just a little bit, because you have kind of a special story about that.
Yeah.
So you've been through so much, Abbi. How have you recovered emotionally? Because you still are, as you've explained.
Yeah, I mean, this is not something that is going to go away right now. Per se, it's something that I'm working through with my intense trauma therapist and my psychiatrist. It's about a med regimen that will work for me. It's also about how you eat, how you sleep, just things like that. And I feel like that's the most important part of it.
Well, social media does have some special powers. There's some good things that can come out of social media.
Social media is amazing.
Well, and you have quite a following on TikTok. So tell us about those videos.
Most of the videos are just raw and real, taken as I was, feeling something or upset. And those are usually the ones people connect with the most, and I really love that. And I really love just my followers in general. I've met so many friends through social media who have gone through the same thing or going through something a little bit different, but because of my case, they said that they wanted to continue to go on. And that is why I do this, is to protect just one person from feeling as crappy as I do.
I think that's fantastic, what you're doing. Keep it up.
Thank you.
Keep it up. Well, be sure to ask your questions. You can use the chat on YouTube or Facebook. You can email us at the Medical News Network. That information is there on your screen. So we've talked about your vision, and you told us about the surgery. Tell us how you're able to see. You have the use of your left eye.
Yeah, I can see out of my left eye. It's perfectly good.
And that's your brown eye.
And that's my brown eye.
Tell us about your blue eye.
My blue eye is a reconstruction of my son's that I got donated to me. By the kindest man I probably ever met. But he was so sweet, and yeah, he painted it to exact picture.
So because a lot of times people want their eyes to match, but you wanted yours blue because your son's eyes are blue.
Yes.
That's such a beautiful story. I love that.
Thank you.
I love that. You've been so very public about sharing your story with us on TikTok and on national news outlets. Explain how that has really helped your emotional healing. You're helping others, but it's really helping you so much.
It mainly helps me in a way that when I'm just expressing how I feel, I'm hoping that someone else understands out there somewhere. And when I express how I feel, it helps me move through some of the emotions that I didn't know I was feeling in those moments.
Dr. Wessel, I have to ask you, just from a physician standpoint, you work every day, you see cases, and then they move on with their lives, and then you get reunited with them, several years later. What's it like to be sitting next to Abbi? I have to ask you, just on a personal
It's
aspect.
incredible. It's not something that I actually get very often to see people that we help. So it's
Thank
great.
you for helping me.
Yeah.
I appreciate it.
Of course.
I still remember you guys' little huddle in the mornings when you
Oh,
were
yeah.
all sharing
There's a million of us every time, every morning.
I waited for those mornings so I
The
could hear.
nurses and respiratory therapists and the residents, and there's a whole team. So.
Ready to get after it.
Yep.
So, Dr. Wessel, how does trauma to the chest influence long-term respiratory health for someone like Abbi?
It would really depend on how severe the injury is. Thankfully, the lung injury was a small portion of the lung, so from just a lung breathing standpoint, you shouldn't have any long-term issues with that. But you had to have a sternotomy where we had to split your sternum in half. We also had to kind of crack your ribs on the right side to get in, and so the long-term sequelae of that are really going to be things like chronic pain and in a sense difficulty breathing. Even if your lungs are fine, it may hurt
I have
to breathe.
scar tissue at the bottom of my lungs, and they don't know what could that be from. Could that be from?
And that's probably from old blood that kind of pooled down there and led to scar tissue developing. It's a little hard to know for sure, but with everything that went on, but that's what I would
Just so you
suspect.
guessed.
Yeah.
Okay.
Yeah, and for a patient like Abbi and other trauma patients, I guess there are just lifelong
Questions.
questions and issues that can come up throughout a lifetime, correct?
Yeah, and trauma survivorship is a kind of a growing area of research, and because we're really good at taking care of people when they initially come in, but then it's like what happens to them afterwards, and we don't always see that, and we're trying to develop systems to support patients for after they get out of the hospital, after they survive.
Yeah.
But that's an ongoing body of work.
Interesting.
For sure.
That
'cause
there's research.
I didn't really get much when I left here, like help at all. So it was just kind of here's your medication, here's your treatments, and here you go.
Well, you do have Dr. Maxfield is here, and she is helping you with your pain management. How is that going, and how does that change and evolve over time for someone like Abbi?
Well, I think to Abby's point, she probably is the youngest person I have on long-term narcotics. That for the most part, people on long-term narcotics are people who are older, who've had possibly malignancies or some kind of long-term joint issues, and so it changes your lifestyle.
It does. Yeah.
How do you help someone emotionally through that when she comes to see you? She must have questions. You
Yeah.
probably have built quite a rapport with her.
I think, and she's done it so well, is that the pain medications are to make life easier.
Yeah.
If they're not making life easier, we need to do something different.
Are there other ways to manage? Of course, the medications are going to be required and needed for someone like Abbi. But what are there other ways to kind of help with that managing life?
Yeah, and I think Abbi has done a great job of finding her support, and I think the role she has taken to be sort of a mentor to other people going through that has also helped her healing.
It has.
That she has used that and turned that to be able to heal better.
Yeah, that's helped you a lot.
Yeah, and it has helped a lot. The more I share, the more I connect, the more that I connect with myself again, and I feel like that makes me feel a lot better, and it definitely helps. I love to feel like me again before all of this, not like I feel like a little old lady kind of trapped in a 25-year-old's body.
Dr. Lipka, what advice do you have for somebody on navigating a complex injury like this, who has these multiple surgeries?
Because I still have to get teeth.
You're still going to get teeth coming
it still connects straight up to my cheek.
someone who's had to go through so much, but then still has more to go.
Yeah.
How do they navigate that?
Yeah, and I mean that is the ultimate goal, to restore your form and function. Your teeth, that's usually one of the last things we think about. But initially, we're trying to really get the structures that you do have that were injured right back to where they were before, and then go from there. See what kind of defect we have, and plan reconstruction as needed.
And just emotionally, how do you help someone just navigate this big life change, to say the least?
It's difficult. You just have to be patient, and it takes some time, and it does take multiple procedures to get to where you want. That's for sure. So.
Yeah, thank you.
So do you know how many surgeries you've had total? Countless.
Yeah, countless. I literally cannot count.
And so teeth are next. I think you've mentioned that before.
Yeah,
that you
my teeth are the last thing I want done, the last thing I want to do, because I know I don't have enough bone up there yet, so I'd have to get, some kind of bone replacement or something like that first, and then I can go ahead and get teeth.
Well, let's get to some questions from our viewers this morning. Angie wants to know how long Abbi was in the hospital initially. Do you remember?
I think a month or something like that.
About a month?
Yeah.
Is that
Yeah,
right, Dr.
I think
Russell?
so. It was in early May, if I
May
remember right.
2nd.
Yep. And then it's probably the end of May that you got out of the hospital initially, but you've been back and forth with so many surgeries,
Yeah.
so.
Jill says, what a brave person. You are an inspiration to others.
Aw, thank you.
So again, just thank you for being here this morning to share. Tony wants to know, does Abbi have more surgeries planned? So
Yes.
that plan, those getting your smile back.
I plan on getting my smile back, yeah.
Rocco wants to know if you always remove all bullets and shrapnel, and how do you make that decision?
Yeah. Oddly enough, we don't actually remove bullets and shrapnel that often. If it's something where we see it or feel it, we take it out, but most of the time it's embedded in soft tissue, and we would cause more trauma trying to actually find those fragments and get them
I've
out.
actually had pieces cut out of my hand. Dr. Garg would do he would just like X over it where he saw a piece coming out, and he would just take it out.
Yeah, almost like a splinter, if it's really superficial, sometimes it'll just kind of work its way up to the skin, and eventually we can say, oh, we can see it and feel it and take it out without causing too much additional trauma. But at the initial surgery, we very rarely actually remove bullets or shrapnel.
It's good to know.
Yeah, it's not like the movies. We don't do a little metal pan where we can put it in there or anything. We're not that cool.
Yeah, thanks for clarifying that. Jeremy wants to know, when you have to do multiple surgeries like that, is it because you have to wait and see how the first one goes before doing more, or is it more like a plan that requires a sequence of surgeries?
Oftentimes it's a planned, staged reconstruction. So you have to get the stability of the underlying foundation first before you can move on to some of the other surgeries. So usually there's a plan in general.
Jill has another question. Will the pieces that were left over have the risk of moving?
Not really. The body's really good about kind of scarring things into place, and they don't typically migrate or go anywhere. That can happen, but it's exceedingly rare. Most of the time, if they move, it's where it's already superficial and it just kind of comes up to the skin, but it's unlikely to cause any serious injury to any organs or anything
So the
like
one
that.
behind my eye isn't gonna pop my eyeball?
No, thankfully no.
Okay, I had a dream about that the other day, so I had the question.
Abby's got all sorts of good questions. She's sneaking in some good questions this morning for us. Patty wants to know, Dr. Maxfield, about long-term pain management. She's heard about new medications coming out.
So I think one of the things we do is more multimodal pain management. So, certainly the narcotics, but being more explicit about what the cause of the pain is and how we might be able to focus on that. So, for instance, medications that help with nerve pain specifically, something like Cymbalta or gabapentin.
I take
Lyrica. And then things like, possibly muscle relaxants, sort of looking at what we're dealing with and trying to focus on the underlying cause.
Well, I want to move on to our takeaways from our conversation this morning. Dr. Maxfield, I'll start with you. What do you want people to really take away from Abbi's story?
So, as a primary care provider here at KU, I think it is really valuable that we have the specialties and the teams that we do. That I was telling these gentlemen, if at any point Abbi and I had a question about her care, I'd reach out and then get right back to me. And I think that is something that is really a benefit of the health system.
Dr. Wetzel?
Yeah, I think from my perspective, trauma can happen to anyone, and it does happen to anyone, and we're always here to help out whoever needs it.
Dr. Lifko, what's the big takeaway today?
I agree, though. The team aspect of it, we're really fortunate to have a great trauma department here who can stabilize patients, and then the facial injuries are sort of a secondary thing that we can take care of, but we have the expertise here, the multiple microsurgery expertise, the expertise in facial reconstruction to help patients who have these injuries. So.
Yeah.
I appreciate all of your expertise in talking about this, and of course, cannot thank you enough for sharing. I want you just to take a little minute just to tell us about where you're at right now, because I know you had some big news over the weekend because you and your son made a big move, and you're doing some really exciting things together, and we're just so glad that you're doing well.
Me and my son have finally moved into our own little space. We have roommates, but we have our own lock on our door, and we have a living room and 2 bedrooms. And I saved enough for that. I'm finally getting my victim's compensation. In like 3 weeks it should come. I'm very excited just about the way that life's moving, and I've already been invited to speak again in October on domestic violence awareness, and that's ultimately what I want to do. Is I want to speak, I want to be a public speaker about domestic violence. So for already being invited to a new place to do it, I'm doing pretty well this year.
What do you want people to know about domestic violence awareness? And you said you just want to reach one person, and I have a feeling you're reaching so much more than that.
I just want every person to understand that they deserve the love that they give, and they deserve the love they should get that love back in return, the same amount of love, I just feel like some people are obsessed with being in a relationship and not trying to be on their own for a little while, because being on my own has taught me so much just in the last couple months. And I've been alone for a year now, so.
Well, you're doing well. And I know you wanted to get back to being the mom.
Right.
That you deserve to be. So good luck to you in Styles. And thank you so much for sharing your story.
Thank you, guys.
Yeah.
Thank you to all of our guests for being here with us today, and thanks to our viewers for being here with us. We will see you back here tomorrow. And coming up tomorrow on All Things Brain Health, unlocking the answers to what causes Alzheimer's disease. We'll discuss one of the most personal decisions a family can make, donating a loved one's brain for research.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.